So, sleep is one of the most important factors contributing to your overall health. Good quality, consistent sleep is needed for you to function optimally, both mentally and physically. When we are not getting that good quality sleep consistently, your risk of subsequent physical health conditions like obesity, cardiovascular disease, and type 2 diabetes significantly increases. And let's talk about why that is. So, in the state of insufficient sleep, the hormone that signals that you're hungry, ghrelin, is actually released in higher quantities, while the hormone that signals that you're full, leptin, is released in lower quantities. You're also more likely to make poorer food choices and less likely to be physically active, creating the perfect storm for weight gain and obesity. In addition, in a state of insufficient sleep, it actually triggers your body's fight or flight stress response system that Greg kind of mentioned a time or two, which increases the release of the stress hormone cortisol that causes widespread inflammation throughout your body, weakening your blood vessels, leading to higher blood pressure. That further puts a strain on your heart, leading to cardiovascular disease. And then there's a state of blood sugar dysregulation because when you're not getting enough sleep, your body actually becomes less responsive to insulin, increasing your risk of type 2 diabetes. And then there's the effect that insufficient sleep has on your immune system, significantly dampening its ability to prevent and fight infection. This was actually illustrated beautifully in a study that followed about 153 healthy participants and asked them to track their sleep over a 14-day period. At the end of that period, it exposed them to the rhinovirus, which is the virus that causes the common cold, quarantine them, and then monitor them to see who develops symptoms of the cold. So runny nose, cough, congestion, etc. And found that those individuals who reported sleeping less than 7 hours per night prior to the exposure were almost 3 times as likely to develop symptoms of the infection than those who slept more. That is the power of sleep. And then we think about your mental health, there's a significant increased risk of anxiety and depression because at night, your emotional control centers communicate with your emotional regulatory centers, giving you better control over your emotions during the day. So when you don't allow enough time for these regulatory processes to take place, you have more emotional reactivity and increased risk of those mental health conditions. Insufficient sleep also increases signs of aging, not only in terms of physical appearance with more fine lines, sagging skin, and wrinkles, but also in terms of age-related dementia states like Alzheimer's. And if nothing else, you simply enjoy life more when you're well rested, and you get to enjoy the improvement in energy, motivation, productivity, and mental clarity that come along with it. But for so many individuals, they're not getting the chance to take advantage of these benefits, with more than a third of US adults suffering from chronic sleep deprivation. And I think there's many reasons why people don't sleep, but I think it really comes down to not prioritizing sleep. We've been taught to put sleep on the bottom of our priority list, given whatever time is left after a day full of work and other responsibilities. And we've been taught to really glorify the hustle and grind and view sleep as a reward that we get to earn if we work hard enough, as opposed to the necessity and right that it truly is. I also like to consider sleep as one of the highest forms of self-care that exists. It's one of the only activities that allows us to both restore our bodies and renew our minds every single night, allowing us to be the best version of ourselves the next day, which is vital, which is why it's vital that we put an end to the sleep deprivation epidemic and start getting the sleep we deserve to live the life we desire. And my top 3 tips for doing that, if you take nothing else away from this, write this down, is to prioritize sleep. Simply making sleep a priority will work wonders in terms of your sleep life. Meaning instead of leaving it to the last minute thing you do with whatever time you have left, starting your day and night with sleep in mind. And modeling healthy sleep behaviors for your children so that they see at a young age just how important sleep is. Because believe it or not, how you sleep as a child has a significant impact on how you sleep as an adult. So I think one of the best things you can do for your kids is to equip them with healthy sleep. And then when it comes to prioritizing sleep, it doesn't have to be complicated. I think there are simple incremental changes you can make to your routines to really make a difference in your sleep. And one of the most powerful is to utilize and understand the power of light as it pertains to sleep. Now, we've already covered a lot of this in Greg's presentation, and thank you. But just to reiterate a little bit, light is the strongest factor influencing our circadian rhythms, which is our roughly 24-hour cycle that dictates when you feel awake and when you feel alert. And this is because we have actually evolved to align our circadian rhythm and our sleep and wake cycles with the natural light and dark cycles of the sunrise and sunset. But with the advent of indoor artificial light, we've been thrown out of sync with the natural light and dark patterns, and that has disrupted sleep. However, there are simple strategies and changes you can make to your environment and your routine to really help you harness and utilize the power of light for better sleep. The first of those is to get natural light exposure within an hour of waking in the morning. This is when your body is going to be most responsive to that natural light. And that really helps to reinforce your circadian rhythm to not only increase your alertness during the day, but it also increases serotonin production, which increases your melatonin production at night. The second is to limit light exposure at night and really within an hour or two of bedtime, but also understanding, as we already talked about, not all light is created equal. So it's that blue wavelength of light in particular that has the strongest alerting effect on your circadian rhythm by inhibiting your melatonin release, which is why the next tip is to avoid electronics like the telephone, tablet, computer right before bed, you generally within an hour or two, because they most strongly emit that blue wavelength of light that decreases your melatonin production and impacts your sleep. If you're someone who says, well, Dr. Holliday Bell, I have to be on my computer or I have to use my phone, at least wear blue light filtering glasses or use a blue light filter that's built in on most phones to help block that out. And then when it comes to regulating your light, that is why I like Helight because it really is such a great tool. The red wavelength of light has the most beneficial effect on your sleep by helping to improve your melatonin release, as we already talked about. So finding ways to implement red light into your routine can actually be helpful for sleep. I love the Helight in particular because not only does it allow you to immerse yourself in the right red wavelength of light to help naturally fall asleep faster, stay asleep longer, and improve your sleep quality, but it does so in a way that's simple and practical and easy to implement into your current routine. I really believe that when we talk about making changes to your sleep, it's important that what you are doing is simple and easy to incorporate into what you're already doing. So you don't have to make all of these accommodations that makes it more difficult to stick to. And Helight does just that. I also like the simplicity of the design and the thoughtfulness behind the programming. With the gradual fade out that allows you to sleep in darkness, which, as Greg mentioned, is important, but also have that time for that red light exposure before you fall asleep. And then I love the flexibility of its use. You can use it during your bedtime routine while you're getting ready for bed to increase your melatonin production. You can use it just as you're falling asleep to decrease your sleep latency or the amount of time it takes for you to fall asleep. Or you can use it when you wake up in the middle of the night and have trouble falling back asleep. Also, a great way to get your children involved and get them sleeping better. You can even teach them to turn on their own Helight as they're falling asleep to really help them take control over their sleep as well. And as someone who does a lot of traveling, I actually just returned back from across the country earlier this week. I love that it's portable, so I can use it as I'm away to help sleep better, and it helps me to recover more quickly from jet lag when I return. And no app or anything needed, just a click of a button, and then I'm off to good sleep. Okay, so aside from those things, I do have some other tips for better sleep. The next is to wake up at the same time every single day. This really helps to reinforce your circadian rhythm so that it's taught basically to send those alerting factors at the same time each morning. Sounds like a simple enough tip. I think where people get tripped up is that Saturdays and Sundays are included in every single day. So your circadian rhythm doesn't have weekends off. So it really is important to keep that schedule consistent 7 days a week. You can often get by with sleeping in for about an hour, but you really don't want to do it longer than that. Of course, getting that natural light exposure within an hour of waking, as I mentioned. And a good way to do this is by going outside to go for a walk in the morning, bonus, because that's physical activity, which is also helpful for sleep. You can have your morning cup of coffee sitting out on your porch or patio, or at the very least, open those blinds and curtains nice and wide and do your morning routine near the window, near natural sunlight. Now, speaking of that morning cup of coffee, you also want to limit your caffeine intake. This tip typically is not a crowd pleaser, but it's worth mentioning because of the widespread consumption of caffeine, often as a result of poor sleep. Caffeine is used for its alerting effects, but it has a long half-life of about 5 hours, meaning after 5 hours, half the amount you consumed is still in your system. So if you drink too much and drink it too close to bedtime, it could definitely still be exhibiting its alerting effects long after you're trying to fall asleep. So a good rule of thumb is to limit your intake to the smallest necessary dose that you need to be effective and try not to have any afternoon. You also want to manage your stress and anxiety throughout the day. Walking around super stressed and anxious and then expecting it all to simply melt away because you turned off the lights and got under the covers, isn't really realistic. So you have to be proactive about how you're managing your stress load so you bring a lower load to bed with you. And you can do this very simply by doing things like incorporating enjoyable activities into your day. Scheduling small breaks throughout your day has actually been shown to decrease stress and anxiety. And then taking part in a decompression activity after work that signals that you're transitioning from work mode to the relaxation of home. And then when we switch to night, it's very important that you engage in a consistent, soothing, and relaxing bedtime routine. Not only is that helpful to transition from the stress and anxiety of the day to the calmness and relaxation of the night, but it's also been shown to be protective against stress. In fact, studies have shown that people who routinely engage in a consistent bedtime routine had less sleep disruption after being exposed to a stressful event before bed than those who didn't. It's also a great way to have some me time and should be something you look forward to. An ideal bedtime routine should be somewhere between 45 to 60 minutes and include 3 to 4 soothing and relaxing activities. So that could be dimming the lights for reasons we already talked about, uh, getting in a nice hot shower because that actually causes a decrease in your body temperature that's needed to facilitate the transition to and maintenance of sleep. For the same reason, it's recommended to keep your bedroom nice and cool, somewhere between 62 to 68 degrees Fahrenheit. You can throw on some relaxing music, grab your favorite book. Both of those things are relaxing activities in and of themselves, but can also distract your mind from anxious thoughts that might be keeping you up. And then when you're in bed, nice and comfy and relaxed, you can turn on your Helight and allow yourself to drift peacefully into sleep and to start experiencing one of the best parts of sleep, which is dreaming.